It's Monday, May 23rd, 2011. In this week's BeakerBeat, the M&A train rolls along as another massive acquisition is announced. More on that, plus find out which disease has the most experimental treatments in the drug development world and why. And this is our 100th episode, so we take a look back at some of our more interesting moments of the past 2 years. All that and more in this week's edition of BeakerBeat, brought to you by Allergan. To learn more about Allergan, visit their company webpage on beaker.com. Hello everyone, welcome to this week's edition of BeakerBeat. I'm Mike Justice, thanks for tuning in. Well, we are celebrating an anniversary, Jeremy and I. We've been with the Beaker team for 2 years now. This is our 100th episode. I know what you're thinking. I can't believe we put together 100 straight episodes of a magnificent product like BeakerBeat. Hey, enough with the sound effects. Anyway, we're going to take you on a tour of our Beaker offices based in Raleigh, North Carolina. Going to meet our CEO, Jeffrey Clark, and we're going to go back in time over the past 2 years and see some of the shenanigans that we tend to get into while we shoot this show. But first, here's today's top story.
Look at all these rumors surrounding me every day.
The rumors were true. Japan's largest drug maker, Takeda Pharma, is buying privately held Nycomed for nearly $14 billion. The sale does not include Nycomed's U.S. dermatology unit. The deal is Takeda's second major buy after its $8.8 billion deal for Millennium Pharma back in 2008. Now, the acquisition gives Takeda, primarily an Asian and U.S.-focused drug maker, a new treatment for smoker's lung called Daxus and a portfolio of OTC products. Daxus is a new respiratory drug and will help defray the loss of revenues to generic versions of its diabetes drug Actos. The deal boosts its presence in emerging markets too, as Nycomed is well placed in Russia and Brazil, and last year bought a majority stake in a Chinese firm. Emerging markets made up nearly 2/5 of its revenue in 2010 and should make up 60% of sales by 2015. So tell us what you think about this story or any story that you see in today's show. Very simple. Click on the orange button below us. A box will pop up. Type in your comment. Send it to me. I promise I'll read and respond to every one of them. And as for these trains, these guys are the bane of our existence. Every time we do a show, a train whistle goes off. Train. Of course, my train happens to be going by again. Oh, I want that. That's really good beer. Well, how do you like it now, train? Making noise in your work area. Ah! And when you're done watching BeakerBeat, check out Beaker's blog and see the latest take on the life sciences industry by Hollywood. Here's a clue: bosom buddies. Check out the video clip on Beaker's blog. Okay, so here we are, entering the Beaker suite. And these are the fabulous new offices. The conference room here. Beautiful area. It's Dave Folk here. He's our VP, hard at work. Say hi, everybody. And our sales folks are out hitting the bricks today. And there's the loft, Jeremy. Enough room for a pool table. Or maybe we'll just put you up there. Throw you some cedar chips and some dog food. It'll be fine.
Watch what happens when Beaker adds 1 drop of germ enlarger.
U.S. spending on oncology drugs could grow by 10% per year through 2013. That according to a new report from Medco Health Solutions. Medco's report counts more than 900 experimental treatments now being studied, making cancer the biggest disease category in the drug development world. Using Dendreon's prostate cancer vaccine Provenge as a benchmark, the report predicts that the cancer vaccine market will reach $7 billion by 2015. Besides the evolution of chronic cancer care, drug makers have been focusing on oncology as a potential growth market, and that focus is expected to bear more fruit soon. Obviously, one reason why spending is growing is that cancer drugs are expensive. Medco found that more than 90% of newly approved cancer drugs cost more than $20,000 for just 12 weeks of treatment. Another reason is patients are using drugs for longer periods of time as treatments for chronic illnesses rather than terminal care. So here we are in the nerve center of the Beaker offices, the kitchen. And you can see here we're already ready for Jeremy to move in with the dog food or cat food, whatever it is. Bottle of wine makes the day go by faster, as you know. And here we have the fridge. And potentially a free lunch. Ooh, is that lasagna? GlaxoSmithKline's Avandia will soon go the way of the dodo bird at your local pharmacy. The controversial diabetes drug will be pulled from pharmacies November 18th, according to the FDA. After that, Avandia will only be available in the U.S. through a special access program. It has already been withdrawn in Europe. Avandia was once the world's best-selling diabetes pill, boasting $3 billion in annual revenue. But by last year, that figure had dropped to $680 million. 3 drugs recently approved in the U.S. have now won recommendations for sale in Europe. The EMA's Committee for Medicinal Products for Human Use gave its stamp of approval to Benlysta, the lupus drug from GSK and HGS. Victrellis, Merck's new Hep C drug, and Yervoy, the melanoma treatment from BMS. All three of these meds are expected to become blockbusters, combining for about $6 billion in projected sales. The ex-GlaxoSmithKline lawyer who found herself in the hot seat for obstruction of justice and other cover-up charges has been acquitted. A judge has tossed out the charges, saying that Lauren Stevens should never have been prosecuted in the first place. The FDA has been warning it will go after executives who feel they are up to no good, but this acquittal now has everyone, including the biopharmaceutical industry, wondering what effect, if any, this decision could have on FDA compliance actions. A report published by MarketResearch.com projects that the global market for remote patient tracking tools will hit $9.3 billion by 2014, driven in part by the technology's potential to reduce hospital stays and lower costs. However, the report notes that the technology's high cost impedes its growth in the U.S. Medtronic and Ford Motor have launched a prototype of a device that can enable patients with diabetes to monitor their blood glucose levels while driving. The system connects Sync, Ford's in-car communication system, to Medtronic's continuous glucose monitor using Bluetooth technology. Shire has agreed to buy Advanced Biohealing, the maker of a diabetic foot ulcer treatment, for $750 million in cash. The deal comes a day before Advanced Biohealing was to go public. The company's Dermagraft skin substitute product will become the cornerstone of a new Shire unit focused on regenerative medicine. Dermagraft brought in about $146 million in 2010 sales. This deal could add to the lure of Shire as a target itself by Big Pharma. Shire's portfolio includes best-selling ADHD drugs and rare disease treatments. It has a strong pipeline and a projected 15% revenue growth, which analysts claim makes Shire an obvious takeover target. Kalamazoo, Michigan-based Stryker is buying OrthoVita, a specialty spine and orthopedic company, for about $328 million. OrthoVita is based in Malvern, Pennsylvania, and competes in the $5 billion orthobiologics market with its Vitas bone graft substitute, among other products. Thermo Fisher Scientific may soon gobble up a former subsidiary of Pfizer. According to sources, Phadia, a maker of blood tests for allergies, asthma, and autoimmune conditions, could get an acquisition offer of as much as $3 billion from Thermo. The deal would significantly expand Thermo Fisher's specialty diagnostics business by about $500 million a year. Okay, everybody, so here we are with Jeffrey Clark, Beaker's CEO.
Hey, everybody.
Now, Jeff, 2 years ago, you made that phone call that you brought us on to do BeakerBeat. What do you think about that?
Somehow I was left out of that decision.
Wonderful. Anyway, let's take a look back at our best 2 years. 2 years ago, with Jeremy's help, I put together an audition tape for the BeakerBeat host and news director position. The original host, Beth Perry, had decided to leave, so Jeffrey needed a new face for the show. Clearly, he made a big mistake in that department. But as for the show, we beefed it up with more news and added our own twisted take on the industry. Another new thing we did was go out and do the show on location. Any location. In fact, we've either shot or edited shows in 10 states plus Washington, D.C. We've been to industry conferences, visited life sciences companies and research facilities, and of course our favorite spots, the odd and unusual. Here's a sample of some of the places we've been. The Country Doctor Museum, a Revolutionary War historic site, a Star Wars convention, but I want to go to Tashi Station and pick up some power converters, a surf competition, an astronaut parade, the NC State Fair, which had a tractor for Jeremy,
I'm threshing!
The Renaissance Fair, which had no tractors for Jeremy, but some shackles and a winch for me, a 300-year-old cemetery, old car shows, new car shows, and a park dedicated to an albino deer. No, I'm not kidding. We even searched for a statue of MacGyver. It turns out it wasn't him. It's fantastic.
It's fantastic.
Yeah, that's what I said. We also enjoy the holidays too. Take a look. So the message here is that if your employer thinks that you're valuable, that they really like you, maybe even love you, they'll get you an iPad. Right, Jeff? These look very illegal, which means they're good. But another thing that's for certain is I'm going to have a bite at his ham. Ow. And let's not forget trips to the golf course, the basketball court, and other sports venues where I routinely abuse Jeremy to elevate my self-esteem. Actually, my abuse of Jeremy knows no bounds.
I quit!
Good times. Anyway, our travels have led us to meet many interesting and wonderful people both in the industry and in the general public. If you are among the hundreds of folks who took the time to put up with us, we thank you. Now, during the past 2 years, we've gotten incredible feedback on the show from you, the viewers. Most of it complimentary, some of it bizarre, and a few stalker types that still occasionally ask about Beth. Guys, get over it. She's gone. It's been 2 years. She's not coming back. It's like every country music song. She ran off with the dog, the truck, and your best friend. Now drown your tears in bourbon, and let's move on. But seriously, it's been a great ride these past 2 years and 100 episodes, and we expect it to be even more fun moving forward. And seriously, enough with the Beth emails. I will bring back Allie Lee, okay? Even though she's really mean to me, I'll bring her back just for you.
They're launching a new program called the Bad Ad Program. Now, if only there was a bad shirt program.
Some quick hits now, and last week it dawned on me that I made a terrible career choice.
Why? Because you're unattractive, yet you continue to punish the public by being on camera every week.
No, thank you for that. I can't believe you don't like this shirt.
I can't believe you don't believe that I don't like this shirt. It's horrifying. Wait a minute. Why aren't you going?
Well, let's just say when I went last time, things happened.
We're going streaky! Yes!
Yeah, it was a disaster.
Or you had too many margaritas.
Hey, I'm Yukon Cornelius.
Yeah, I figured this captured your personality. Fat, loud, and obnoxious.
Well, I see you decided to be Rudolph. Makes perfect sense.
Why? Because I'm the heroic star of the show?
No, his nose is red and so is yours. Though I doubt he's been drinking wine all day.
Oh, that is just rude!
So there you go. Highlights from the last 100 episodes. What do you think so far?
Here's hoping the next 100 are even better.
Hear that, Jeremy?
Listen, I gotta go. I'm gonna grab some lunch.
Oh, okay. What'd you bring?
Oh, fantastic dinner last night. Lasagna.
Oh, sounds good. Okay, let's go. See you later. So we've got 100 episodes down. We're looking forward to the next 100 episodes. And if it doesn't work out, Jeremy and I will probably just hop this train. You know, hobos do it. How hard can it be? Trouble is, there's no door, Jeremy. I don't know how to get in this thing. I guess we can just climb up. Yeah. This is too hard. I'm just gonna take the car. Screw it. Hate you. Hate you. Hate you. Sit, Beaker. Sit. Good dog. Okay, everybody. Here's Jeffrey Clark. He's the CEO of Beaker.
Didn't we fire you?
That'll go on the back end of the show.